10 ways to control high blood pressure without medication. Lifestyle plays an important role in treating your high blood pressure. If you successfully control your blood pressure with a healthy lifestyle, you may avoid, delay, or reduce the need for medication. Here are 10 lifestyle changes you can make to lower your blood pressure and keep it down. 1. Lose extra pounds and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disturbed breathing while asleep, which further raises your blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. Losing just 10 pounds can help reduce your blood pressure. Besides shedding pounds, you generally should also keep an eye on your waistline. Carrying too much weight around your waist can put you at great risk of high blood pressure. In general, men are at risk if their waist measurement is greater than 40 inches. Women are at risk if their waist measurement is greater than 35 inches. These numbers vary among ethnic groups. Ask your doctor about a healthy waist measurement for you. 2. Exercise regularly. Regular physical activity, at least 30 minutes most days of the week, can lower your blood pressure by 4 to 9 mm of mercury. It's important to be consistent because if you stop exercising, your blood pressure can rise again. If you have slightly high blood pressure, exercise can help you avoid developing full-blown hypertension. If you already have hypertension, regular physical activity can bring your blood pressure down to safer levels. The best types of exercise for lowering blood pressure include walking, jogging, cycling, swimming, or dancing. Strength training also can help reduce blood pressure. Talk to your doctor about developing an exercise program. 3. Eat a healthy diet. Eating a diet that is rich in whole grains, fruits and vegetables, and low-fat dairy products and schemes, unsaturated fat and cholesterol can lower your blood pressure by up to 14 mm. This eating plan is known as the dietary approach to stop hypertension, DASH diet. It isn't easy to change your eating habits, but with these tips you can adopt a healthy diet. Keep a food diary. Writing down what you eat, even for just a week, can shed surprising light on your true eating habits. Monitor what you eat, how much, when, and why. Consider boosting potassium. Potassium can lessen the effect of sodium on blood pressure. The best source of potassium is food, such as fruits and vegetables, rather than supplements. Talk to your doctor about the potassium levels that are best for you. Be a smart shopper. Read food labels when you shop and stick to your healthy eating plan when you're dining out too. 4. Reduce sodium in your diet. Even a small reduction in sodium in your diet can reduce blood pressure by 2 to 8 mm of mercury. The effect of sodium intake on blood pressure varies among groups of people. To decrease sodium in your diet, consider these tips. Read food labels. If possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. Don't add salt. Just 1 level teaspoon of salt has 2300 mg of sodium. Use herbs or spices to add flavor to your food. Ease into it. If you don't feel you can drastically reduce the sodium in your diet suddenly, cut back gradually. Your palate will adjust over time. 5. Limit the amount of alcohol you drink. Alcohol can be both good and bad for your health. In small amounts, it can potentially lower your blood pressure by 2 to 4 mm. But that protective effect is lost if you drink too much alcohol. Drinking more than moderate amounts of alcohol can actually raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medication. Quit smoking. Each cigarette you smoke increases your blood pressure for many minutes after you finish. Quitting smoking helps your blood pressure return to normal. People who quit smoking, regardless of age, have substantial increase in life expectancy. Cut back on caffeine. The role caffeine plays in blood pressure is still debated. Caffeine can raise blood pressure by as much as 10 millimeters of mercury in people who rarely consume it, but there is little to no strong effect on blood pressure in habitual coffee drinkers. Although the effects of chronic caffeine ingestion on blood pressure are unclear, the possibility of a slight increase in blood pressure exists. To see if caffeine raises your blood pressure, check your blood pressure within 30 minutes of drinking a caffeinated beverage. If your blood pressure increases by 5 to 10 millimeters of mercury, you might be sensitive to blood pressure rising effects of caffeine. Talk to your doctor about the effects of caffeine on your blood pressure. Reduce your stress. Chronic stress is an important contributor to high blood pressure. Occasional stress also can contribute to high blood pressure. If you react to stress by eating unhealthy food, drinking alcohol, or smoking, take some time to think about what causes you to feel stressed, such as work, family, finances, or illness. Once you know what's causing your stress, consider how you can eliminate or reduce stress. If you can't eliminate all of your stressors, you can at least cope with them in a healthier way. Change your expectations. Give yourself time to get things done. Learn to say no and live within manageable limits. Try to learn to accept things you cannot change. Think about problems under your control and make a plan to solve them. You could talk to your boss about difficulties at work or to family members about problems at home. Know your stress triggers. Avoid whatever triggers you can. For example, spend less time with people who bother you, or avoid driving in rush hour traffic. Make time to relax and to do activities you enjoy. Take 15 to 20 minutes a day to sit quietly and breathe deeply. Try to intentionally enjoy what you do rather than hurrying throughout your relaxing activities at a stressful pace. Practice gratitude. Expressing gratitude to others can help reduce stressful thoughts. Monitor your blood pressure at home and see your doctor regularly. Home monitoring can help you keep tabs on your blood pressure, make certain your lifestyle changes are working, and alert your doctor to potential health complications. Blood pressure monitors are available widely and without a prescription. Talk to your doctor about home monitoring before you get started. Regular visits with your doctor are also key to controlling your blood pressure. If your blood pressure is under control, you might need to visit your doctor only every 6 to 12 months, depending on the other conditions you may have. If your blood pressure isn't well controlled, your doctor will likely want to see you more frequently. Get support. Supportive family and friends can help improve your health. They may encourage you to take care of yourself, drive you to the doctor's office, or embark on an exercise program with you to keep your blood pressure low. If you find you need support beyond your family and friends, consider joining a support group. This may put you in touch with people who can give you an emotional or moral boost and who can offer practical tips to cope with your condition.